Welcome to this short conversation that I'm going to be having with Dr. Mike Scanlan, who's a nurse consultant in mental health, and he works through his organisation kindminds.org. And before that, Mike worked for many years in the NHS, delivering therapies in the mental health in the community setting, and in recent years more and more using mindfulness to help patients. So we're going to talk to Mike in a moment, and first I just want to give you a sort of definition. I've seen a couple of definitions of what mindfulness is. Mindfulness is a state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts and bodily sensations, used as a therapeutic technique. And John Kabat-Zinn defines mindfulness as, he says, mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And John Kabat-Zinn was one of the key people that brought mindfulness out of its roots as a Buddhist meditation, so that it's that was the roots, but now it's a secular practice of mindfulness and is used widely in the Western world, in the US and the UK, and is very much mainstream these days. And quite a lot of that change has happened through the work of John Kabat-Zinn. So we have run mindfulness as webinars a couple of times in the past, both for patients and a couple of times for doctors, mainly GPs, but anybody is welcome who's a healthcare professional. And I wanted to record a conversation with Mike ahead of our 2016 mindfulness-based stress reduction course. And so that was the motivation for having this conversation with Mike today, so that for those of you who are not familiar with the webinar format, it's basically listening in. It's like watching the TV, but you can contribute by typing in comments through a little control panel. But you'll be watching Mike and listening to Mike as he delivers mindfulness information and mindfulness exercises that we do together live. And then obviously the webinars are recorded, so people can access the recording at a time that's suitable for them. And there are audio exercises and a course manual. But the principal content is delivered through a digital format, the live webinars and the recordings, and then audio exercises, mindfulness exercises that people can download and use on their smartphone or tablet device. Use it where is convenient for you, so you're not tied to a desktop or laptop to be able to do the mindfulness course. So mindfulness, my understanding, mindfulness has benefits for us as human beings in a few different ways, and I just wanted to share this. So mindfulness is good for our bodies. There are various studies, a lot of research about mindfulness now available. You can find it easily online. And there was a seminal study that found that after just 8 weeks of training and practicing mindfulness meditation, it boosts our immune system. So it helps our ability to fight off illness. It's good for our minds. Several studies have found that mindfulness increases positive emotions while reducing negative emotions and stress. And at least one study suggests it may be as good as antidepressants in fighting depression and preventing relapse. It changes our brains. Researchers found that it increases the density of grey matter in the brain regions linked to learning, memory, emotion regulation, and empathy. It helps us focus, helps us tune out distractions, and improves our memory and attention skills. It fosters compassion and altruism. Research suggests mindfulness training makes us more likely to help somebody in need and increases activity in the neural networks involved in understanding the suffering of others. and in regulating emotions. So it might boost self-compassion as well, and I'm sure Mike will touch on that. And it's there is evidence that it's good for healthcare professionals coping with stress, connecting with our patients, and improving our general quality of life. And it helps mental health professionals as well by reducing negative emotions and anxiety and increasing their positive emotions and feelings of self-compassion. So I'm very pleased to have Mike join me today for this conversation. And Mike, if I could start off to just have you explain a little bit of your background and how you came to mindfulness.
Yeah, I mean, I've been working in mental health for about 25 years, and I've been trained in a whole range of different therapies. I suppose mindfulness was the thing that helped me out most, because I think that, as for many of us out there, working in a health environment, we find ourselves reacting to stress in quite unhelpful ways. And I had certainly become far too fused with worries and concerns, mostly about the future. And there's this thing that used to really, really get under my skin, which is, I term it repetitive doubt syndrome. So that when you come home, finding it hard to switch off. And about 5 or 6 years ago, I went and did my mindfulness training. And I did it as much for myself as I did it in order to train and to use it with clients. But since finishing that training and becoming what I would now term as a mindful practitioner, and someone who's run this mindfulness-based stress reduction courses, I think above all, it's the one thing that kind of keeps me present. It keeps me vaguely sane, and it certainly enhances my life. And I think the biggest thing it does for me is it allows me to live in the moment and to recognize some of the precious stuff that life has to give us, which before I think I was just glazing or skating over. So that's sort of been my journey, and I really enjoy running courses almost as much as I do with my own personal mindfulness. It's great to have a skill like this that you can share.
Thank you very much, Mike. Mike, could I ask if somebody is undertaking mindfulness training in whatever form, whether it's as a webinar course that we're going to run over 8 weeks, or whether they're accessing mindfulness training in some other way, how soon is it before, you know, if I'm new to mindfulness and start training, how soon before I would start to feel any benefits?
Well, if you buy into, or if you are somebody that has that sort of road to Damascus moment where you sit back and all of a sudden, right from the first session, you have that moment where your stance to life changes, then the benefits can begin immediately. So what I mean by that is, quite often when I'm running the first session and we get the comments back and someone will say, oh my goodness, Jim, I've just realized that I haven't lived in the moment for the last 10 years. I spend all of my time either thinking about what's been or ruminating about what will come. So I guess for some people, the change is immediate. For most people, the research suggests that as soon as we begin to regularly meditate, that's when we start to really get some significant change occurring. The best research comes from a 2008 study by a guy called Dusek. And the research there was saying that it's after about 2 months of regular meditation of around 17 minutes per day that you really begin to see the drop in the cortisol level, and your heart rate variability shifts, so you spend more time in parasympathetic nervous activity. But my sort of experience of running these courses are that people tell me that if you engage with the therapy and if you engage with mindfulness and you build up your meditation to only like 10 minutes a day, then people start to notice a difference.
Thank you very much. So 10 to 20 minutes a day and building it up as we go along.
Absolutely.
And could you say something, Mike, about how mindfulness and mindfulness-based stress reduction, how does it differ from CBT?
Yeah, from classic CBT, I think it differs majorly in that rather than challenging our thoughts, the essence with mindfulness when we're working with unhelpful thinking is to allow the thoughts to be, and to be non-judgmental, and to allow thoughts in, allow them to be with us. And very quickly we begin to realize that thoughts are like stingless bees. They sort of invade our space, they buzz loudly, they look quite scary, but actually they have no sting. And it's only when you sit with thoughts non-judgmentally, patiently, and with a kind of compassion that you realize that thoughts are like these stingless bees. And that's the main difference, I think. Of course, there is mindfulness-based CBT as well. And the main difference there is that rather than challenge thoughts, we're curious about these thoughts that push into our lives.
Okay, thank you very much. And how long do I need to meditate for? We did touch on this, but if you could clarify, how long do I need to meditate for per day to benefit?
Well, you know, in the beginning of the course, for the first few weeks, we're literally 5 or 10 minutes a day, and people benefit right from that moment. So we usually start with things like the body scan. And the moment somebody engages with the body scan, it depends. If you're someone who tends to have a lot of somatic symptoms and perhaps pain or discomfort, the body scan can be useful from the very get-go. So yeah, as soon as you get up to 5 or 10 minutes, then you begin to experience benefits from the process.
Fantastic. Now, some colleagues I know listening to this will be thinking to themselves, well, I've tried meditating, but I haven't got the concentration. So what could you say to those folk?
Now, this is the one that most people get hung up on. And actually, because with mindfulness, what we say is there's a huge level of acceptance with mindfulness and letting go. And whenever I'm running a mindfulness course, I always use the smile. And the smile is crucial, I believe. And so when we are interrupted and when we find our concentration wavers, smile, recognize that your concentration has wavered, and gently escort your attention back. Now, the very fact that you have been mindful enough to be aware that your concentration has deviated tells me that you're being mindful. So you're mindful of the fact that what was automatic is no longer automatic.
Thank you very much. So that's encouraging for those who've concerned about the ability to concentrate. Now, how interactive can we be on the webinars? Obviously, the main course is delivered through an 8-week webinar series. How interactive can we be by our webinars, Mike?
Oh, extraordinarily, really, and it works so much better when people use the chat function. So after whenever we finish a meditation, for instance, and we ask people to make comments, we ask people to let us know how they're doing, and we always share that with the rest of the group. We're careful to only use first names because we don't want to breach anyone's confidentiality, of course. But the other thing we can do is we can say, using the sort of hands up approach, we can ask everybody out there, you know, how many of you found that in the last meditation that your concentration was impacted or you deviated more than once? And you know, very early on, 90% of people will do the hands up, and we can share that. And just by getting that sense that my experience is shared, people's anxieties about the process of being mindful tend to drop. So in some ways, I mean, right at this moment, I'm running this evening, I'm running a mindfulness live course. And when I finish a meditation and I stop and I say, has anyone got any thoughts? And quite often we get a sort of mindful silence there. I almost think we get more interaction via the webinar because people feel less inhibited about sitting in their front room and typing in a comment or sharing a comment than they do speaking. allowed in a sort of drafty church hall.
Okay. Yes. Thank you very much for that, Mike. So some colleagues listening to this may have actually tried either meditation or a mindfulness exercise, because there are lots of little snippets of sort of exercises people can try that are available online. And some colleagues might want to say to you at this moment, you know, when I've tried before, I fell asleep, and how can I stop falling asleep when I do one of these exercises?
Yeah, I mean, that is really a common thing, especially if we are tired and we're busy people. One of the really important things is that our position when we do meditate, so we have to think about the role of the amygdala, our fear center. So I always say to everybody, I'm not a real stickler as some mindfulness practitioners are about posture, but what I do say is make sure that you're looking dignified. Now, if we're looking dignified and alert, there's much more chance that you're going to be able to get through the exercises without falling asleep. But the second thing I'd say is, you know, if you fall asleep, be mindful of what that's telling you. Be mindful about, you know, what your brain and your body are trying to say there. So there is no judgment with mindfulness. So if you fall asleep, you fall asleep. That's your experience.
Now, Mike, we're calling the course is a mindfulness-based stress reduction course, but I'm sure some colleagues are going to be wondering, you know, will this help me more than just feeling less stressed? Could you say something about that?
Yeah, I mean, without a doubt, it definitely helps with stress, but I think what it also does is it really shines a light on how compassionate we're being to ourselves and to people around us. So in terms of building our sense of self-compassion, quite often I will say, I will begin a meditation by saying, okay, let's just get in touch with the fact that we are giving ourselves time. We are valuing ourselves enough to spend the next 10 minutes just meditating when we could be doing all of those jobs. And so it really is about there's self-compassion, there's happiness, and there's a woman called Martha Lynham who talks about making life more vital. And for me, it really is a happiness thing, you know, that we live in a very, very beautiful country. And how often do we drive and notice that beauty? How often do we walk and notice that beauty? So mindfulness brings a whole range of unexpected gifts as part of the process.
And I know that there is research showing definite benefits for things like anxiety.
Oh yeah.
People who have problems sleeping can often benefit. So thank you for that. So that a richer life and a happier life, a greater sense of well-being.
Yeah, I mean, there's a good evidence base that it helps with pain as well. So, for instance, the body scan. Once we become more mindful about where we experience physical sensations such as pain, we actually develop the skill and the potential to be able to take our attention to another part of the body mindfully. And so, yeah, huge benefits for quite a wide range of different conditions, really.
Thank you very much. And I think the last question that often comes up and is a concern for some colleagues, especially when they're aware that there's a sort of the roots of mindfulness come from Buddhist meditation. Is there a spiritual or religious side to mindfulness-based stress reduction courses?
I think that we run it in a very secular way, but so many of the comments that I get from people are that people, if that's your experience is your experience, and if you want to use a religious one, we think about Julian of Norwich, who was a Christian mystic who actually speaks about mindfulness and says, what you find when you're meditating is what is. And so for some of you, it might be a spiritual experience, but for other people, it can be purely secular. I think it depends on your definition of spiritual. I suppose that sometimes you certainly do get a much greater, deeper insight into a sense of peace and tranquility and equanimity, and all those sort of experiences, I believe, are spiritual, but we make no attempt to add a deliberate spiritual element into it.
Excellent. Thank you very much. I think that's probably as many questions as I'd want to cover today on this conversation with you, Mike. I really appreciate you taking time to talk to me today and answer those questions. And so just for anybody who's interested, on the page where you're watching this recording, there will be information. You can click a link to go to a page where you can sign up for the 2016 mindfulness-based stress reduction course. So have a look for the link on the page where you're watching this, and I'll hopefully see you on the course. Any final words, Mike?
No, just the more people we have, the richer the experience is, because, you know, so I would really encourage you to take this opportunity, because as I said before, the evidence we're getting, there's 2 randomized controlled trials now that are very clear that mindfulness delivered in this way is hugely effective. And it's just so easy to do it from your home, you know? And so I would really encourage you to give it a go.
Excellent. Thank you so much, Mike. And look forward to seeing you on the course, but we'll be talking before then. And thank you all for taking time to listen in to this conversation. I wish you an enjoyable and mindful rest of your day.
Bye for now. Yeah, bye-bye now.